This video is going to be on selective hypoglobulinemia, which means that the globulins are decreased and they are disproportionately decreased relative to albumin. So selective hypoglobulinemia exclusively occurs in young animals, and we're really going to talk about two diseases, and that's failure of passive transfer of immunity, or FPT, and severe combined immunodeficiency, or SCID. Failure of passive transfer is by far the most common cause of selective hypoglobulinemia that we see clinically, and this disease primarily occurs in horses and cattle. So failure of passive transfer is when the neonate does not ingest enough colostrum from the dam, and in doing so they do not acquire enough antibodies. So that leads to an immune-compromised state, which can result in secondary infections, which then causes inflammation. So within the CBC, you're going to be looking for signs of inflammation within the leukogram. So colostrum also contains other substances besides globulins, and that includes enzymes such as gamma-glutamyl transferase, or GGT, and alkaline phosphatase, or ALP. So in some species, you can see low concentrations of these enzymes in the neonate. In particular, this happens more commonly in cattle relative to horses. Also in cattle, the screening test for failure of passive transfer is a decreased total protein by refractometry, but this isn't really a reliable test in foals. So colostrum also contains a lot of glucose, so energy for the neonate. So if there's decreased ingestion of colostrum, you can see hypoglycemia. And then finally, albumin is also often affected, and albumin could be either increased due to dehydration because, again, the foal's not eating or drinking, or it could be decreased because albumin is a negative acute phase protein. Severe combined immunodeficiency, or SCID, this is a very rare disease, and it tends to occur in certain breeds of animals. In particular, in horses, it can occur in Arabians and Appaloosas, and I'm just going to abbreviate that app. But it has been documented in some dog breeds as well. So SCID results from failed development of lymphoid tissue, so it never develops in the first place. And in the SCID, affected animals tend to have a marked and persistent lymphopenia, so a decreased lymphocyte count. But the hypoglobulinemia and the clinical signs of disease, they don't occur until the maternal antibodies wane. So compared to failure of passive transfer, where you see clinical signs within days or weeks, animals with SCID don't present with clinical disease until they're months of age.